Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
pain from acute obstruction of ureter. Okay, there is pain and this pain is due to acute obstruction of ureter or stone. So, whenever there is acute obstruction, whatever the reason is, whenever there is acute obstruction can be due to anything. It can be due to a stone. When the stone which is present in the renal pelvis, it passes through the ureter, it results in acute obstruction, or it can be due to the blood clot. So whenever this results in acute obstruction, then this will cause pain. So from the renal pelvis, when the stone passes to the ureter is obstructed. When there is this acute obstruction will result in ureteral pain. Then this ureteral pain, why is this ureteral pain present? The reason for pain is because of, or the cause of pain. The cause of ureteral pain. There is one reason for ureteral pain. One, there is renal capsular distension will be there. See, whenever there is obstruction, the kidney will be continuously producing the urine. The urine gets accumulated here. The kidney has a capsule, okay, and the kidney also starts to swell, and when it starts to swell it will distend the capsule, or it will make the it will cause distension of this capsule, or it will stretch the capsule. Okay, when it stretches the capsule is innervated by the nerves. So because the capsule is innervated by the nerves, these nerves gets activated, resulting in the pain or back pain. Okay, that is one thing. Along with that, that is one reason for ureteral pain. Second pain is due to the renal pelvic or ureteric muscle spasm. Why? Because in the ureter, in the wall of the ureter, when it gets obstructed, the wall of the ureter definitely contains muscle fibers. These muscle fibers will become spasm, that is, they will contract suddenly. So this will also result in pain. So there are two reasons of pain mainly. So one, it is renal capsular distension. So renal capsular distension will result in back pain of the patient. Okay, and second, there is also renal pelvic or ureteric spasm. This renal pelvic or ureteric spasm will result in colicky type of pain is seen in them. Okay, now this renal pelvis or the ureteric spasm, this is the one which will radiate from the costovertebral angle down towards the lower anterior abdominal quadrant, that is along the course of the ureter. So this renal pelvic pain which is present, it radiates from the site of obstruction downwards to the through the course of the ureter. So this is the one which is radiating down towards the anterior abdominal quadrant. Okay, now the severity on colicky nature of the pain. This colicky nature of the pain is mainly caused by peristalsis, and it is also caused by the spasm. Because of the peristalsis, hyperperistalsis, and the spasm of the muscle, there is severe, this pain is severe and it is in colicky nature. Why? Because this stone is a foreign body, and our body always tries to emit out or eject the foreign body. So in the attempt to get rid of the foreign body or to overcome the obstruction, the smooth muscle undergoes hyperperistalsis, along with the spasm of the smooth muscle is seen. So because of this hyperperistalsis and spasm of the smooth muscle, this will determine the severity of the pain. Okay, so if we say clearly, so the ureter will try to, or will attempts to get rid of the stone. by itself, or it will try to overcome the obstruction. So in order to do this, in order to get the stone away from itself, from the ureter, it undergoes hyperperistalsis. It contracts vigorously along with the spasm. So this contraction and spasm is responsible for the severity and colicky nature of the pain. Then then now the site of the pain and the radiation. If the stone is in the upper ureter, if the stone is in the upper ureter, the pain will radiate along the testicles. This is important. It radiates to the testicles when the stone is in the upper ureter, because the nerve supply of the ureter, of the testis and the kidney is similar, and it is T11 to L12, because the nerve supply of the testis and the kidney and the ureter is same. That is, it is T11 to T12, and as a result, the stone will radiate to the testis because of the same nerve supply. Second, if the stone is in the middle of the ureter, if the stone is in the middle of the ureter, it is referred to the McBurney's point, and it mimics the appendicitis. If the stone is present on right side, then if the stone is present on the left side, it will resemble or it will mimic the diverticulitis or other diseases of the descending or sigmoid colon. Here, the nerve supply which is responsible for this middle ureter pain is T12 to L1. Then, stone in the lower ureter. Stone in the lower ureter, it will get referred, it is in the stone in the lower ureter, the pain is referred to the inner side of the thigh, scrotum or perineum, and this is through because of the L1 and L2. The nerve supply of this lower ureter, thigh and the scrotum and perineum, all this is L1 and L2. So as a result, the pain is referred to the inner side of the thigh. Then, if the stone is at the level of orifice, if the stone is at the level of orifice, then you will see symptoms of frequency and urgency may occur.
Thank you and thank you for watching.